Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for following our channel. And as you know, I'm a cosmetic surgeon in Richmond, Virginia, and I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts, and I'm usually talking about facelift and eyelids, etc. But today I want to do kind of a different video, and I'm going to aim this, the target audience here would mostly be doctors, and especially young doctors who may not have heard this message. Now, I have a little document here that's in our employee handbook, and it's called Our Commitment to Patients. And I'm sure I probably did this, I probably put it together myself, but I certainly didn't make all this up, and I may have even copied it from somewhere else, so I can't take credit for the entire authorship here. But this little piece of paper is very powerful because it addresses the importance of the patient. And I hate to read, but I'm going to read these and discuss each one. Number one, we are all patients ourselves. We treat our patients as we would want to be treated with dignity and care. And that's so important. Every doctor is a patient. Every nurse is a patient. Every assistant is a patient. We go to other doctors, and we know from our personal experiences what it feels like to be treated great, and maybe what it feels like to be treated not so great. Dignity, that's very important. You always want to be in a professional environment and deserve the doctor's commitment to time and to be able to talk to them frankly. And the other thing here, dignity and care, and obviously care is something that why we're going to the doctor. The next things, our patients don't interrupt us. They are the reason we exist in the first place. And if you really want to run a patient-focused practice, you have to understand, and I tell all my employees, and they already know this, the patient's our boss. Okay, without the patients, we have nothing. And, there are some doctors, unfortunately, some doctors are really arrogant. And, patients feel that they're bothering the doctor when they ask a question, or that all of us are in a rush, okay? One of the things that patients need to understand when you run a surgical practice, it's unpredictable. So if I'm doing a facelift, one case may take me 2 hours, another case, same thing, may take me 3 hours. That puts me an hour behind, and we certainly don't do it intentional. We try to be on time, but we have to remember that patients don't interrupt us, okay? That's the reason that we're there. Number three, our patients are not just add-ons. They're the most important people in our day. And again, when you have a busy schedule and somebody calls and they want to be seen, and it's going to kind of mess up your schedule and mess up your day, we bend over backwards to try and accommodate these patients because, again, it all goes back to the first thing. We are all patients as well. And when I have something that bothers me, I want to be seen right away when I can. Our patients are not medical record numbers. They are human beings who deserve our respect, courtesy, and professionalism. And again, sometimes I feel like I'm preaching to the choir because I feel that I know this for sure, and I feel that my staff know it for sure. But again, all of us need to look in the mirror and question how we're treating our patients and running our practice. And, we want our patients to feel that they have our complete attention and our time, and that we're not in a rush. And most busy doctors have very busy practices, but we have to be able to fulfill those patient expectations. They're not charts, they're not numbers, they're our reasons for existence. Our patients are not dependent upon us. We are dependent upon them. I've already alluded to that. Without my patients, I don't have a practice, okay? So they're my boss. They're important. They're the thing that we focus on. And when we have staff meetings and we're training new staff, this is so important to explain this. And it's so much of it is common sense, but sometimes when you read these things and think about them, it's just a double check, like, hey, am I doing this right? Our patients are not people we check in at the practice. We warmly greet them. And when you go to practice management sessions and you talk about the flow of patients, this right now we're in the middle of COVID for everything, but everything's different. But normally, patient call, they make an appointment, they come to your office, they park their car, they check in, and you know, you're trained to go through these steps, especially as employees. Well, we want to put a personal turn on it. We don't check them in. We greet them. We welcome them. We thank them for coming to our practice. Our patients have a choice. We recognize and appreciate that they chose us. And I want to tell you, you know, in my experience, most successful doctors are pretty humble people. They're not arrogant, unapproachable. Oh, hey, I'm a doctor. I'm more important than you. You can't bother me. And, you know, I've always given my patients my cell phone. And I love going to work because I can sit down and interact with my patients. And when I meet a new patient, I'm interested in them. What do you do for a living? Tell me about your family. So it's so very important, and it's such an honor. We have a international practice, and we see patients from all over the United States, all over the world when there's not a pandemic. And you know, I'm so thankful when a patient walks across the street to my office. But when people come from out of town and out of state, it's just even such a big honor. So these are something that every doctor should remember. And finally, our patients aren't just more work to do. They honor us by allowing us to provide care to them. And again, looking at the entire picture, when somebody chooses us, you know, they're putting their faith, they are investing financially, and usually a lot of thought goes into it. And so at the end of the day, even if you've been in practice a long time like I have, it really helps to look at these things, and especially for your staff, and especially for new staff and new doctors, to understand that in everything that we do, the patient is our boss, and they're the most important things in our practice. Hope this hasn't been boring. And I hope that the target audience benefits from this. I'm Dr. Joe Niamtu, lovethatface.com.